folks, welcome to Rigid Scholars Beyond Just Books. Today's topic is temporal bone. It's a topic of anatomy and osteology. Today we are breaking down the temporal bone, one of the most complex bones in the human skeleton, housing the organs of hearing and balance, articulating with the mandible and containing crucial neurovascular structures. This bone demands your attention. Let's explore its intricate anatomy. The temporal bone is a paired bone forming part of the lateral skull base and the sides of the cranium. Each temporal bone contributes to both the cranial old and the skull base, making it a transitional structure. The temporal bone consists of 5 distinct parts: the squamous part, the petrous part, the mastoid part, the tympanic part, and the styloid process. These parts fuse together during development, but understanding each component separately is essential for grasping the bone's overall architecture. At birth, the temporal bone exists as 3 separate bones: the squamous, petromastoid, and tympanic components. They fuse during the first year of life. The styloid process ossifies separately and fuses later. This complex anatomy houses the middle and inner ear structures, forms the temporomandibular joint, and provides attachment for multiple muscles. Let us understand the squamous part. The squamous part is the largest and most superior portion. It's thin, flat, and scale-like, hence the name squamous. This part forms the anterior and superior walls of the temporal bone. The outer surface features the zygomatic process, which projects forward to articulate with the zygomatic bone, forming the zygomatic arch. This arch is crucial for facial structure and provides attachment for the masseter muscle. At the base of the zygomatic process lies the mandibular fossa, also called the glenoid fossa. This concave depression articulates with the condyle of the mandible, forming the temporomandibular joint. Just anterior to the fossa is the articular tubercle or eminence, which guides mandibular movements during jaw opening. The squamous part's inner surface shows grooves for the middle meningeal vessels and depressions for cerebral guiding. The superior border is beveled and articulates with the parietal bone, forming the squamotemporal suture. Understanding this anatomy is fundamental for TMJ disorders, fracture patterns, and surgical approaches. Let us understand the petrous part. The petrous part is the most dense and hardest bone in the human body. It's pyramid-shaped and projects medially and anteriorly from the mastoid part, forming a substantial portion of the skull base. The petrous pyramid has a base, apex, 3 surfaces, and 3 borders. The apex points anteromedially towards the body of the sphenoid bone. Near the apex lies the internal acoustic meatus on the posterior surface, transmitting the facial and vestibulocochlear nerves along with the labyrinthine artery. The anterior surface faces anterolaterally and forms the posterior wall of the middle cranial fossa. Here you will find the arcuate eminence marking the position of the anterior semicircular canal. Lateral to this is the tegmentum tympani, a thin bony plate separating the middle ear cavity from the middle cranial fossa. The posterior surface forms the anterior boundary of the posterior cranial fossa. It contains the internal acoustic meatus, which opens into a canal that divides into separate channels for the facial and cochlear nerves. The inferior surface is rough and irregular. It contains the carotid canal anteriorly, transmitting the internal carotid artery. The jugular foramen lies posterolaterally between the petrous, temporal, and occipital bones, transmitting the internal jugular vein and cranial nerves 9, 10, and 11. The petrous part houses the cochlea, vestibule, and semicircular canals, the complete apparatus for hearing and balance. Let us understand the mastoid part. The mastoid part forms the posterior inferior portion of the temporal bone. Its most prominent feature is the mastoid process, a conical projection that descends behind the external acoustic meatus. The mastoid process provides attachment for several muscles: the sternocleidomastoid, splenius capitis, and longissimus capitis muscle. Its size varies considerably between individuals and is generally larger in males. Internally, the mastoid part contains the mastoid air cells, a system of interconnected air-filled cavities lined with mucosa. These cells communicate with the middle ear cavity via the mastoid antrum. This connection is clinically significant. Middle ear infections can spread to the mastoid ear cells, causing mastoiditis. The mastoid notch, located medial to the mastoid process, gives origin to the posterior belly of the digastric muscles. Medial to this lies the occipital groove for the occipital artery. The mastoid foramen near the occipital border transmits a small vein and occasionally a branch of the occipital artery. Tympanic part in the styloid process. The tympanic part is a curved plate of bone located inferior to the squamous part. It forms the anterior, inferior, and posterior walls of the external acoustic meatus. At birth, the tympanic part is merely a C-shaped ring called the tympanic ring. It gradually expands to form the complete bony external acoustic canal by adulthood. This developmental fact explains why the external acoustic meatus is shorter in infants. The styling process is a slender pointed projection extending downward and forward from the inferior surface of the temporal bone. It varies greatly in length, typically measuring 2 to 3 centimeters, but can be much longer in some individuals. The styling process gives attachment to 3 muscles and 2 ligaments. The muscles are the styloglossus, stylohyoid, and stylopharyngeus. The ligaments are the stylohyoid and stylomandibular ligaments. Collectively, these structures are called the styloid apparatus. An elongated styloid process called Eagle syndrome can cause throat and neck pain, especially during swallowing. This condition is relevant in differential diagnosis of facial and cervical pain. Let us understand the clinical significance. The temporal bone's clinical significance spans multiple specialties. Temporal bone fractures classified as longitudinal or transverse based on petrous pyramid orientation can damage the facial nerve, causes paralysis or rupture the tympanic membrane, causing hearing loss. Mastoiditis requires understanding of air cell anatomy for surgical drainage. The proximity of the sigmoid sinus and dura to mastoid air cells makes surgery delicate. Temporomandibular joint disorders involves the mandibular fossa and requires detailed knowledge of this articulation. The petrous carotid canal's course is crucial in skull-based surgery. Damage here causes catastrophic hemorrhage. The internal acoustic meatus provides surgical access to vestibular squamous but risks facial nerve damage. That's temporal bone anatomy, 5 parts, complex architecture, and immense clinical relevance. From hearing to jaw movement, this bone is truly remarkable. This is Ridgely Scholars Beyond Just Books. Keep learning, keep growing. Thank you so much for watching this video. See you in the next video.